Some of the developments we are tracking: global cases of confirmed coronavirus now hovering at the 21 million mark, more than 5.2 million of them here in the U.S., and the death toll growing to well over 759,000 worldwide. With me here to start us off, ABC Chief Medical Correspondent Dr. Jen Ashton. Dr. Jen, we're focusing on back to school this week, and we're talking about college football. A lot of the leagues canceling it, and the American Heart Association has just released a statement to increase awareness about how COVID may affect the heart. What do we know about heart health as it pertains to athletes who may have had COVID?
Well, I think, as we have said from the very beginning, Amy, it is always important to say what's known and what's not known. The American Heart Association statement is really bringing to light that we don't know a lot about long-term effects to the heart after COVID-19. But in particular, especially with respect to athletes, we're worried about a condition called myocarditis. This is an inflammation or infection of the heart muscle. This is a leading cause of sudden cardiac death in athletes under the age of 35. Now, we do have to remember, as a population, athletes do, of course, tend to be younger and healthier than the general population, which would tend to go in their favor. However, and this is the big but, the long-term effects from COVID-19 on the heart are still unknown, and that's why the American Heart Association just came out with this statement.
All right, so are there any recommendations at this point for athletes who've had COVID-19?
So these return to play guidelines, as they're called, are evolving in real time. There are some recommendations put out in the journal JAMA for asymptomatic people diagnosed with COVID-19 completely without symptoms. The recommendations are to rest completely for 2 weeks after getting that positive test result, and then a slow return to play while monitoring that athlete for symptoms of myocarditis.
Right, and that might be hard if you are asymptomatic, but also if you have mild symptoms, what should you do?
So they then distinguish between those cases of COVID-19 in athletes that had mild symptoms. Again, complete rest for 2 weeks after symptoms have resolved, so they're extending that period of convalescence, and then they are suggesting a cardiac evaluation depending on symptoms again. So these are people who had symptoms but weren't hospitalized. Then if you go into the severe cases, Amy, and we know that that's luckily a minority of the people with COVID-19, those hospitalized, the recommendations for return to play: complete rest for 2 or more weeks with a full cardiac evaluation and what's called a myocarditis protocol. So they're specifically looking for this heart effect. That cardiac evaluation involving an EKG, a blood test to look for troponin, which is an elevated marker of cardiac damage, an echocardiogram, extensive. They are really trying to delineate what athletes could be suffering from myocarditis. It's important to catch it, obviously, and it's difficult to diagnose in athletes who are young, healthy, and stoic.
All right, we appreciate that very important information, Dr. Jen. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.